Thank you for tuning in to Dear Momma podcast, part of Airway Circle's radio station. This is episode 8, Tying It All Together, and I am your host, Catherine Murphy. Today, our guest is Lisa Lahey. Many of you may recognize her name from the book Tongue Tied. So let's set the stage with the following quote. Cherish your family, for they are your treasure, a storehouse of riches and wealth beyond measure. Lisa was chosen as my guest today for the profound effect she's had on families. Through her work, she's been able to support families on their health journey in a myriad of ways. Let me share with you all of her experience. She is a holistic family nurse practitioner with more than 25 years of experience and baby expertise. Lisa worked in the hospital for 17 years in labor and delivery, postpartum, NICU, and perinatal services before starting her own private practice. Lisa is trained in feeding therapy, infant massage, craniosacral therapy, myofascial release, and myofunctional therapy, working with adults to babies. Lisa has an established private practice called Advanced Breastfeeding Care and Wellness that provides breastfeeding medicine and pediatric well visits. She recently expanded her office space and added a studio that offers infant massage, float spa, and yoga. Lisa is a contributing author to the book Tongue Tied and lectures on oral function and therapy and lactation issues. She has continued to hone her skills through education and training that align with her passion and pursuit of healthy children and families. Lisa is also a proud mom to 5 children. She's a native of Indianapolis, and she loves to sing, travel, bike, and hike in her free time, which she doesn't have that much of. So I really appreciate her taking time to join us today. So welcome, Lisa.
Thank you, Catherine. Thanks for having me. I'm excited. This is my very first podcast.
What an honor.
That would be fun. And you're doing a great job. So it's been really fun to see you evolve and professionally and personally, because I met you back with Patrick.
Yes. So listeners, Lisa is actually the myofunctional therapist that is the one that really brought his tethered oral tissues to my attention. We were at the 2017 AAMS. And so the orthodontist that she was working with at the time messaged me and said, oh, just so you know, my myofunctional therapist is there and she might be willing to take a look at Patrick. So when I use those pictures in my presentations and you're seeing the fingers showing his lip tie and his tongue tie, those are Lisa's, which Lisa, I have to share with you that I was showing a group of dental hygienists those pictures. And they were like, where is that person's gloves? I said, oh, no, it's okay. That's my son.
Yeah.
And I never thought anything about it because we did that in my hotel room.
Exactly. Yeah, I do wear gloves. But yeah, sometimes you're doing it on the fly, right? We did wash our hands. And
Yes.
I remember being in the hotel room and kind of laying him on the bed to assess that. But, wow, what a jumping point for learning. And I think a lot of us who have delved into tethered oral tissues and, all of the accompanying myofunctional therapy and oral function, breathing, airway, we're passionate because we first got started with our own children or perhaps our own experience with tongue tie or airway ourselves. So it's kind of melded, together. And I think that for sure, that's why so many of us keep going, because we see the effects that it has, just not only in our own families and our own lives, but also with the patients that we're called to serve.
And that is why my appreciation for you runs so deep. For those, I'm going to share a little bit more of that story that have been in a position like me, where kind of an anxious new mom, where I knew something was wrong, but I wasn't quite sure. And Lisa just being with Patrick, and she had just that calming effect on him. She joined us for dinner, and he was about, 6 months old at that time. Wasn't really interested in very many foods. She's like, here, let me just take some of your chicken off your salad. he is sitting next to her, which normally he didn't want to be next to someone he didn't know. He was so comfortable with her. She had him eating chicken and he just kept eating it, which we were struggling for him to eat anything that really required chewing because he had large tonsils, his tethered oral tissues, etc. And it's so profound when someone is so gentle and has that easing spirit with them, with babies, knowing, okay, yeah, baby, you've got this going on, but we can take care of this. So I really appreciate it. And I love the fact that now she's reaching even more people with your spa. So if you can describe, you've had such a great path from nurse to author to speaker to holistic nurse practitioner to owner of the Oh Baby Spa. So can you explain what that spa is and what floating is for babies?
Sure. Well, definitely in my work as a lactation consultant and just helping, young babies and toddlers with feeding difficulty, you definitely see that parents are really stressed and they're looking for a positive connection. So if your day is filled with lots of focus on feeding and failure and the baby won't latch on and I've got to get through the aftercare, I was really kind of like, well, what could I do in my space, in my office that I really love that I can share with parents? And I really had already, done a lot of infant massage classes in the past and love infant massage. I love massaging babies. I love teaching parents how to massage their babies. But I find that it's such a good connection, not only when you have a young child, a young baby, but then as they grow. So it was something that I really loved with my children. And I would use it like, yeah, if you go brush your teeth, mommy will massage your back, when we're done. So I found that I was able to do it and keep that connection going. So that was really why that back in March, I opened Oh Baby Spa in addition to, seeing patients every day at my office. I hired a couple of nurses and trained them in the infant massage. I do a couple of sessions per week too. And so a session usually is about 1 hour. We also have like a special parents' night out with their baby, where we have a charcuterie board and champagne sip, and just kind of like really make it a nice event for both the mom, dad, and baby. But the session kind of starts like this. They sign up online. We have them come in and we do a guided massage for about 30 minutes.
Oh.
During that time, of course, we're just talking about like, hey, what's going on with your baby? Do you have any questions? Such as developmental milestones. I talk about tummy time. We touch on feeding. Definitely, we've done some like, hey, what do you see going on with your baby's mouth? So we've done some of that too. But really, that session is just focused on teaching the parents how to interact and do the massage. And babies just really love it. They coo, they cuddle, and we finish up the massage. Then at that point, we have really deep soaking tubs. They're about 30 inches deep with water. They take about 30 minutes for us to fill. And we add Epsom salt and some essential oils. So they really get this sensory experience as well, besides the warm water, besides the Epsom salt, which is a smooth muscle relaxer, and then the smell of an essential oil that the mom chooses. The baby gets to float kind of freely with a little neck ring. So it is a special ring called the hoverfush, and the baby is able to float, and you'll just see them kind of moving their bodies a lot more. So particularly for babies who might have a cranial strain pattern or a torticollis, this is a way for them to move. And I always, ask parents, like, how do you feel after a warm shower or bath? For me, that's a reset, right? If I'm having a tough day or, I'm just like, okay, if I just go take a warm shower or a bath, I'm going to feel a lot better. So it's no different for the babies. The benefits of the water therapy are the warmth, the movement that baby can experience freely back in kind of a womb environment. And there are some research studies that show that it helps babies with like gross motor movement, also, hitting some of their milestones. If they are not able to freely move out of the water, then they're able to do that in the water. And it's just plain fun. We have a lot of pictures on our Instagram that people could check out. Oh, Baby Spa Indy. It is the third spa. There's one in Chicago, there's one in Houston, and there's me.
Wow.
So there you go.
I love how you have the names that go along the ring. It's so cute. And the babies they look so nice and relaxed. I'm like, wow, if only Patrick had ever looked like that ever in his first year. So what is the youngest and what's the oldest that can use the spa?
Yeah, there's not really an age limit. It's more about the weight, because the float is tested from 7.5 pounds to 25 pounds, and also kind of the length. So we have floated a baby as old as 1 year. And I do think that's kind of our limit, because those babies are starting to stand up and push off the bottom of the deep soaking tubs. But they were still, enjoying it. And we have definitely floated, a 2 and 3 week old baby that is brand new, and they really love it. I really haven't had a baby yet who, screamed or persisted in getting out. They sometimes just need, that voice and that soothing or a rattle to kind of get them eased into what this feels like. But most of them really settle, and the parents are like, oh my gosh, she's never been this relaxed. They fall asleep afterwards. They often want to eat afterwards. So again, I have just found, probably the main reason that I love it so much is for my patients who are typically struggling, and then other people who come to the spa, it's a good connection point, because there's not a lot that you can do with your baby as far as an activity or, something of that nature with the brand new baby. And this is, so, it's the massage, it's the floating, it's just a chance for parents to ask some questions. And I think when you're, sitting with the parent on the floor and you're on the massage mat, they feel comfortable. And I know for myself, when I'm doing massage with anyone, I'm relaxed by that experience too. You really can't be, a stressed out massage person and massaging someone else. So it's super great for just that kind of Zen experience for everybody involved.
I love that, because then the baby can actually see the parent, that the parent can be relaxed around them. Because that's the other concern that, I was that mom. I was that stressed out mom, spinning, trying to get the answers. And I don't know how often Patrick got to see me really just relaxed. And it's important that they see what relaxation is, so that they're picking up everything from their mom. So if they can actually see the mom can slow their breath down, relax, they have a higher likelihood of doing that as well. And I love that they can get started so young. That's awesome.
It's so fun. And I just can't agree with you more. Sometimes when I'm working with moms, I start there. If I'm working with the mom on feeding, we're so focused sometimes on all the tasks that we do that we don't really check in with mom. And I had that experience yesterday with a patient. And, as lactation consultants, we're really unique because we definitely have 2 patients every time. I've got to figure out all the mom stuff going on, whether that's her emotional state or her milk supply. But then I've got to figure out all the baby stuff, the oral stuff, and how baby is doing. But I could tell that this mom was really stressed, and she was in a lot of pain because she had a plugged duct. Baby was definitely tongue-tied, was only a week old, hadn't been sleeping, the list goes on. And the first thing that I did was would it be okay if we just took some deep breaths together and just kind of found our center before we start? So I find that a lot of times that helps me. And that was really advice that came from a really good mentor who was my nursing instructor 25 years ago, saying, you have everything that you need. You have your eyes, you have your ears, you have your hands, you have your brain. But a lot of times before we step into that space with patients, we have to kind of center ourselves and ask ourselves, like, use me, use my hands. Let these words be kind words. Let my voice be effective in explaining tethered oral tissues and the frenectomy that's going to happen. And then I think for moms, again, it would be, kind of praising them for what's going well, because so many times we're focused on what's going wrong. And I think for me as a practitioner, that's something that experience has taught me. I know a lot, but I can't point out everything that's going on and downloading that with the mom in an hour and a half consult. So sometimes, I've held back a little bit more so that they don't feel so overwhelmed by everything that we note with their child. And the same is very true with myofunctional therapy evaluations and ortho assessments. The parent's like, oh gosh, my child is broken. But you have to be able to say, like, I've noticed a lot, and we're going to focus on these 3 things. And then I need you to come back for a follow-up, because I think as practitioners, we kind of want to fix and give everything at one appointment, right? And it doesn't do any of us, any good at all.
Yeah, leaving them feeling overwhelmed. And I appreciate you mentioning, how you have the 2 patients, because I have that too, like with orthodontics. If the parent is nervous about whatever appliance you might be putting in, all that, then the child like feeds on that. If the parent didn't have a good experience with dentists in general, then coming in, I've had so many patients think they're going to get shots and all. I'm like, number one, when I was a general dentist, I never used the word shot. Like, let's just not use that ever. And in an ortho office, I promise them, like, you'll never ever see one in my office. But there's still parents are like, I don't know. Like, no, let's be calm and positive. So they'll be calm and positive. Speaking of calm and positivity, since you mentioned frenectomies, how would you, in an ideal world, which I understand even with my own daughter, I didn't get everything done with her frenectomy in an ideal way because we're dealing with human schedules and she was born right around Thanksgiving. But to incorporate possibly floating so that the baby can get calm, the mom can get calm, and that anxiety that kind of goes along with the frenectomy before and after, especially the after, because I feel like, that's part of why I wrote Dear Momma, is because on those Facebook groups that you introduced me to, it doesn't matter how prepared the mom is always like, okay, did I do the right thing? Did I do the right thing? So would you recommend before or after both? Which one would you prioritize?
It probably depends. Of course, I do think that in my practice, whether it's a baby or an older child or an adult that I'm preparing for frenectomy, I like to have at least 2 to 3 visits before the frenectomy. That's not always possible because sometimes the frenectomy is needed right away when we're talking about a baby, because the breastfeeding ship may sail. She may not be able to hold on a couple more days or a couple more weeks. So we all have to be very timely with that, optimal timeline or optimal preparation of frenectomy. So I do think it's patient dependent, but I guess in my dream tongue tie land, that I would say at least 1 or 2 appointments. Our one is the initial assessment, and then we're doing a follow-up, kind of making the plan of like, this is what I want you to be doing. So even with young babies in my practice, I have parents practice the aftercare stretch at least once a day while they're getting, in contact with the doctor or the chiropractor or the physical therapist or whoever is doing body work. I teach them oral exercises, and I like to start with oral exercises. So that might be like a really nice cheek massage. I'm going in the mouth, working on lateralization and extension. We might do some traditional suck training, sweeping under the tongue. And then we kind of save the last part, the true aftercare wound care stretch, for the end. And I have them follow that, of course, post frenectomy. So if we're talking about babies, ideally, I'm doing 5 aftercare stretches a day for 2 to 3 weeks, depending on the healing of lip and tongue and buccal ties. If we're talking about older kids and adults, it depends on, where sutures placed, where they not placed. I still believe in doing what I call myo-light post frenectomy, even if you have sutures, because as a nurse with surgical experience, we get all patients moving the next day after a surgery. And in my opinion, post frenectomy, even with sutures in place, we want to be moving that, but gentle and not putting, a lot of extra strain. I think so many things have changed since, frenectomy started a little while ago, that we're doing better about not teaching vigorous rubbing over the wound bed. We're really doing gentle lifts of the tongue, lingual palatal seal, suction hold, and then maybe like a gentle sweep of the tissue, but no vigorous rubbing that's stirring up granulation tissue or the wound bed. So that's kind of in my ideal world. Yes, things happen before. If it's with me, I would love to float babies before and after, just so that there's some calm and happy. But then I'm definitely working on, pre-frenectomy oral habilitation, and post-op. We're definitely doing that too across the lifespan.
Wow. Thank you for going through all that, because, I think this is one time I can speak for everyone in the airway field, that we're really trying to just make sure that, mamas, caregivers understand that the frenectomy alone is not the goal. It's all the prep and post work. And that's where most of the time when we're reading things online, they didn't have the proper consult before and after. They didn't have the proper support, or they may have felt too overwhelmed and they didn't hear it. And so they didn't follow up, or they felt too scared to really ask, well, why chiropractic care for a baby? What is craniosacral therapy? What are you talking about light touch therapy on my baby? I just want my baby to eat. And so they don't do the follow-ups for all those reasons, and to shift that focus also to that caregiver that's coming to you. So thank you for that reminder, because that is one of the big goals of this podcast and all of us in the airway circle. Well, with most of my podcasts, I only get through the first question. So since we are, because I always try to make these podcasts be about the time of someone's commute to and from work, or to and from wherever they might be going, if they're running errands. So let's just see if there's any other like mom to mom wisdom that you would like to share with us, Lisa.
Oh, goodness. That's a big question too. Well, I think, being a mom of 5 and now having adult children, I have a daughter and 4 sons, and my daughter is an SLP and delving into all of that fun oral function, all the way down to my son who is 10. Each child comes to the world with their gifts, and we don't always see that right away. We don't always understand our children's behaviors. And, I've had the blessing of having 5 kids. And so, some of them have different struggles and gifts than others. And so I feel like as parents, our job is to kind of really discern, like, what is their gift and what can I help them, grow with? And, I guess I even want to say like mentor or foster. And then, what's this struggle teaching us? So, I've definitely had that with one of my children, where it was like, okay, what's the lesson here? Because I'm having a hard time figuring out what this lesson is. But then seeing like, okay, this is their journey, this is their path, and this might be, different, and I'm stressed over it. But, I can still be a good mom. They can still be a great human. And just figuring that out for them, and a lot of times when it's, something medical that I'm kind of referring to, you really have to be a fierce advocate and kind of trust that your mom instinct is correct. So I really encourage that with my patients. It's like, you're with your child more than I am. You know what they're doing. You hear them breathing. You see them eating. I get to see them for an hour or two at best in my office. So I really trust what the mom is seeing and telling her to research that, or let me give you a resource for that. So that's what I really think for parents. I think when you have the luxury of seeing your adult children too, you're like, okay, I didn't do too bad. Like, I got through, they survived. They're doing okay. And that's really rewarding, where I feel like when you're in the young parenting, it's so hard to feel that feedback of like, I did it. So it comes, right? And I think for mothers and parents, all parents, it's really nice to have some mentorship. So whether that's through something like, your podcast, or your girlfriend who's already had, young kids, and she's telling you about what's coming next, or how you talk through things, and some of more of the difficult life decisions, that would be what I would say. Trust your instincts, find your child's gifts, have a mentor mom that you can really say, like, what did you do in that situation? Or, how did you handle this?
I love that. Thank you. And that reminder that every child is here for their own journey, and we are here to support them and for them to also learn from that journey as well as us. Speaking of moms and getting moms calmed down, Bree Grish and I created the Take 3 for me as a sustainable self-care movement, and Lisa has agreed to participate in the Mindset Reset. Normally what we do, it's 3 steps that we can do every day to reset and refocus. Step 1 is a gentle movement. Since we're on here and our listeners can't see us, I remind everyone to just kind of, even if you're sitting in the car, just kind of wiggle around a little bit, get more in tune with your body. You've been focusing on whatever you're doing and listening. So now just kind of shake it all in, let that come in. And then the second portion is the Mindset Reset, where Lisa's going to either share one of the 3 things we kind of challenge you to look at every day: what you are proud of yourself for, your intention for the day, or what you are grateful for. So which one would you like to share with us?
I think probably, let me look again. What did you say there? What am I grateful for? What am I proud of? What is your intention for the day? I'm going to say what my intention is for today.
Awesome.
So, yeah, my intention for myself and for your listeners would be, just letting you feel your whole body. I feel like sometimes we just are so disconnected from like that mind body, and we try to like stuff it. So, sometimes I'm like, yep, my shoulder hurts. I'm going to feel my shoulder. I'm going to massage my shoulder. I'm going to take a deep breath, and I'm going to feel better.
Which is actually the final step of the Take 3 for me, which is the breath work, to connect your mind with your body, where we just also ask for you to take 3 intentional breaths anytime you need to reset and refocus and see how your body is. So if everyone just takes 1 deep breath, ideally in through your nose and out through your nose, you should feel just that nice tuning of your body of like, oh, I can be relaxed. So thank you so much, Lisa. And listeners, I truly know that this is just the beginning. I know Lisa's schedule is so busy, and I say this, that I would love to have her back. I would greatly appreciate if you'd leave a 5-star review so more mamas can get notice of this community that we are building. And stay tuned for our next episode, which is titled From Athlete to Airway Advocate with Anne-Marie Nano. She is a college athlete turned health coach who is passionate about helping people transform their lives through building healthy habits. She has discovered the importance of Airway, and she loves to share that she's on TikTok. But until next month, please enjoy all those magical mama moments. Thank you so much, Lisa.
You're welcome. I'd be glad to come back and hope everybody has a great day.
Love that. Thank you.